Hello. If you're watching this, you are most likely a healthcare professional who works closely with diabetics. Throughout this presentation, I hope to highlight the potential role of occupational therapy being part of the interdisciplinary team for diabetic patients. And if you're a referring clinician, why occupational therapy services should be sought out for your patients regardless of how long they have been diagnosed. While you have presumably heard of occupational therapy and have maybe even referred patients to an OT practitioner in the past, we are a highly underutilized branch of medicine for type 1 diabetics. Whether you're completely familiar with occupational therapy or not, we'll be going over some of the scope of our practice and how diabetes is tied into it. As occupational therapists, we specialize in teaching, educating, and supporting participation in any activity or occupation that takes up an individual's time. When people hear the word occupation, they often immediately think of the word's connotation for job or employment. However, the formal definition is an everyday activity that people do as individuals, in families, and with communities to occupy time and bring meaning and purpose to life. Everyone from babies to seniors has occupations, and we often take many of them for granted until they become disrupted or are difficult to do independently. As we will discuss throughout this presentation and with many of the educational presentations provided on this site, many different occupations across the lifespan can be impacted by a type 1 diabetes or T1D diagnosis. And in the event of being referred to an occupational therapist, it would be their job to try to identify those barriers and create interventions or strategies to revise or create new habits, roles, or routines to allow for independent, safe, and healthy participation in all of these occupational categories as desired or needed. There are 9 main categories of occupations. Activities of daily living, or ADLs, are the activities oriented toward taking care of one's own body and are completed on a routine basis. This includes things like showering, dressing, eating, functional mobility, and even sexual activity and intimacy. Instrumental activities of daily living, or IADLs, are activities that support daily life within the home and community. This includes activities such as providing care for children, pets, or others, driving, financial management, home management, religious expression, and shopping. Health management is the activities related to developing, managing, and maintaining health and wellness routines, including self-management. This includes medication management, physical activity, personal care device management, and communication with the larger healthcare system. As you may have already guessed, this is a large occupational area for people who have been diagnosed with diabetes, both type 1 and type 2. Rest and sleep is exactly what it sounds like, the activities related to obtaining restorative rest and sleep to support healthy and active engagement in other occupations. Play is defined as activities that are intrinsically motivated, freely chosen, and that may include exploration, humor, risk-taking, contests, and celebrations. Fun fact about play, it is actually considered to be the most important occupation for children and adolescents since they often gain many of their most vital developmental skills from solo play or play with others. Leisure is essentially the adult version of play. Social participation is the activities that involve social interaction with others. Education is activities needed for learning and participating in the educational environment, both formal and informal. And lastly, work is labor or exertion related to the development, production, or management of objects and services with financial or non-financial benefits. The body of knowledge regarding occupational therapy's role in diabetes management is currently limited. However, there is a vast collection of research related to the range of complications, obstacles, and challenges that come with a T1D diagnosis. As we will discuss, occupational therapists are more than equipped to handle many of these challenges. People with type 1 diabetes experience a multitude of physical, mental, and occupational barriers or negative effects due to the condition's associated complications. One study conducted in 2018 sought to understand how diabetes affects daily life and, in turn, reveal the unmet needs of this population. Almost half of the survey participants with T1D were taking medications or undergoing treatment for depression. Respondents also identified many basic aspects of life in which their T1D diagnosis has had a negative impact, with more than 66% identifying self-confidence, success at school or work, planning for the future, and, quote, ability to take on life's challenges as the most challenging aspects. 1/3 of respondents also identified various relationships from family and friends to relationships with coworkers or students, as well as intimate relationships also having been negatively impacted due to their diabetes. In the same study, participants with type 1 diabetes identified the 5 biggest barriers to their diabetes management as the following: cost of medications and devices and care, stress involved in managing diabetes, side effects from diabetes medications, difficulty sticking to diet and exercise routines, and daily medication management. Participants identified a variety of diabetes devices used to manage themselves, but despite this wide range of diabetes medication methods being used, many of them were experiencing serious complications related to their diabetes, including high blood pressure, eye and vision problems, neuropathy, and foot problems. Additionally, nearly 2/3 of participants had an A1C level above 7.0%. The disparity highlighted by these statistics indicates that despite the dramatic advancement and improvement of diabetes management technologies and therapies, a clear disconnect or lack of education still exists between the proper or most appropriate use of diabetes management methods that not only addresses the impact on quality of life by T1D as well. Other studies have looked at the impact of type 1 diabetes on other occupational areas. A 2016 study found that participants with diabetes were found to have a lower average verbal intelligence level compared to those in the control group. Not only that, but students with T1D missed a more amount of school days than their healthier counterparts. A 2016 systematic review explored the sleep disruptions associated with T1D as a result of behavioral and physiological aspects of the condition and its management. It was suggested that those with T1D spend more time in stage 2 sleep or lighter sleep rather than in stage 3 or deep sleep compared to those without T1D. Additionally, research has suggested that those with significantly higher A1C levels self-reported more frequent sleep initiation problems. Those with T1D also spent less than 6.5 hours every night on average with higher A1C levels compared to those who received greater lengths of sleep per night. Lastly, mental health and depression is an area highly impacted by a T1D diagnosis, and many studies have found that those with T1D experience not only higher rates of depression, but also lower self-perceived scores on standardized quality of life scales. Worse mental health outcomes often lead to difficulties adhering to daily regimens and diabetes care routines, which in turn can lead to less controlled diabetes. One of the most referenced studies regarding the role of OT within diabetes is the Resilient, Empowered, Active Living with Diabetes, or REAL Diabetes study. This randomized controlled trial sought to assess the efficacy of an OT intervention program designed to improve psychosocial well-being and glycemic control for 81 young adults of low socioeconomic status. Participants underwent 7 content modules focused on different topics, including goal setting, self-management, knowledge and skills training, access and advocacy, establishing and maintaining healthful routines and habits, social support, emotional well-being, and long-term health. After receiving the intervention, participants at the time of post-test saw an average decrease of 0.575% in their A1C levels and increased scores related to diabetes-related quality of life. Approximately 1.45 million Americans have T1D, including 250,000 children and adolescents. If current incidence and prevalence rates continue, it's estimated that this number will increase to nearly 2 million within the next 20 years. Diabetes costs the United States $327 billion in annual healthcare expenditures, including $16 billion related specifically to T1D. Average medical expenditures for the diabetic population are about 2.3 times higher than expenditures for those without diabetes. However, despite these increased healthcare costs, it's estimated that less than 1/3 of all people with T1D have consistently achieved targeted blood glucose levels as evidenced by increased A1C levels. So the last thing we'll discuss is the actual role of OT in diabetes management and why we should be a notable presence when working with this population. There are many reasons why you should refer your diabetic patients to an occupational therapist. Occupational therapists take a holistic approach to diabetes management, addressing not only the medical aspects, but also the individual's lifestyle, environment, and psychosocial well-being. This comprehensive approach can lead to better outcomes and improved quality of life for patients. We work closely with patients to develop personalized treatment plans tailored to their specific needs, preferences, and goals. Through this, we are able to support patients in making and sustaining behavioral changes related to diet, exercise, medication adherence, and self-care by employing motivational strategies, goal-setting techniques, and behavior modification approaches. All of this is in an effort to prevent serious diabetes-related complications by promoting healthy lifestyle behaviors, optimizing glucose control, and addressing risk factors such as poor nutrition, sedentary behavior, and inadequate self-care practices. Lastly, collaborating with occupational therapists allows endocrinologists and other healthcare providers to offer comprehensive and integrated care to their diabetic patients. OT clinicians can communicate treatment progress, identify potential concerns, and make appropriate referrals to other members of the healthcare team as needed. Occupational therapy plays a valuable role in the management of both type 1 and type 2 diabetes by focusing on enhancing an individual's ability to perform daily activities and maintain overall health and well-being. Keeping in line with the scope of practice for occupational therapy, all of our interventions are non-pharmacological. We help individuals with diabetes make necessary lifestyle modifications to manage their condition effectively. This includes providing education on healthy eating habits, physical activity, stress management, and self-care practices. Occupational therapists can also assist individuals with diabetes in developing self-management skills necessary for monitoring blood glucose levels, administering insulin or other medication, and adhering to treatment plans. We can utilize various techniques such as goal setting, problem solving, and cognitive behavioral strategies to empower individuals to take control of their health. OTs can assess the need for assistive devices and technology to support diabetes management. This may include recommending tools such as glucose meters, insulin pumps, continuous glucose monitors, and apps for tracking food intake, exercise, and medication adherence. We also provide training on how to use these devices effectively. Self-management skills can also include helping patients in facilitating conversations with their endocrinologist or other members of their healthcare team if they feel as though other types of assistance are needed but do not know where to start. This is especially true for OT practitioners who are certified diabetes educators, as well as those who are healthcare professions that can obtain this certification. Occupational therapy as a profession has its roots in mental health care, so it makes sense that when working with diabetics, we can address the psychosocial aspects of living with diabetes, including stress, anxiety, depression, and adjustment to the diagnosis. We provide counseling, emotional support, and coping strategies to help individuals navigate the challenges associated with managing a chronic condition. Lastly, occupational therapists can assess the individual's home, school, work, and community environments to identify potential barriers in diabetes management and recommend modifications or adaptations to promote safety, accessibility, and adherence to self-care routines. Thank you so much for watching my presentation, and these were my references. Thank you.